Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, it's just me. I'm going to be answering a question that I've heard a lot lately. Before we get into the show, I want to remind you that the holidays are coming up, and if you're looking for a book or a gift, a book is a great gift. I have my book, Welcome Back, a TBI recovery story from provider to patient that kind of chronicles the first year of my recovery from my own traumatic brain injury that occurred back in 2023. I'm taking notes for that next episode as I'm getting back to being a nurse practitioner again. So watch for that next edition of the book, next edition of the book to come out at some point once I'm more healed and ready to share the rest of the story, as they say. So if you're looking for a gift, that's a great option. And if you're looking to make any kind of contributions, may I suggest a contribution to the show here as well? So in these show notes, there's a link to buy me a coffee. Not actually buying me a coffee, you're supporting the show. So I do all my own stunts, all my own tricks on this show with the help of this Riverside app. Thankfully, they're not paying me, but they did send me a t-shirt. Yay! So anyway, if you're listening, thank you for sticking around. Thank you for being here week after week. If you're new to the show, there's so much interesting stuff to hear, so go back and listen. We've had a lot of episodes on this show already. So we're a couple of years in, and I'm really excited about all the things that are coming up. I've got some really cool interviews booked and upcoming. But for today, getting into today's show, it's just me again, as I mentioned. I get this question a lot. What happens if I had a TBI and it didn't get diagnosed? So I get this question a lot. I have family members coming in with a loved one that's being seen now, and they'll say, well, I had this injury or somebody else had this injury. Is there anything else that can be done, or what's the risk of them not getting the diagnosis? So we're going to talk about that today and just what happens when that TBI does not get diagnosed. TBI, again, being traumatic brain injury. When we classify it, again, this year, 2025, we had a new recommendation for a new classification system come out. That's not in place yet, so we still have the old diagnoses of mild, moderate, and severe TBI. Mild TBI is a concussion. A concussion is a mild traumatic brain injury. And mild just means the terms of when you have the injury. It makes no difference for long-term outcome. So again, when we're looking at this, mild TBI and all the historical documentation of diagnoses of this, or diagnosis, it is a brain injury that occurs. You had an injury, you didn't lose consciousness, and you didn't have any changes on your imaging. That's it. That's your mild TBI. That's your concussion. So if somebody tries to say, well, you didn't have any changes on your imaging, so you're going to be just fine. Not the case. It just means you didn't have a bleed or a head fracture. So moderate TBI, you have a loss of consciousness, but still no change in imaging. That's moderate TBI. Severe TBI, you have a loss of consciousness greater than 24 hours, or you have changes on your imaging. So once you've got changes on your imaging, that puts you into that severe category. Again, mild, moderate, severe, it's just for the time of injury. So when we're looking at those mild TBIs, the concussions, this is most often where it doesn't get diagnosed. I've had some people show up to my door where they did have a loss of consciousness and didn't get diagnosed with a TBI or weren't told that they needed to do anything for it. But most often what I see are those concussion patients, the quote unquote mild TBIs that had a concussion, no loss of consciousness. So everybody thinks of the old research from 20 some years ago that said most patients will get better within 21 to 28 days and you don't have to do anything for them. And it used to be the case that if anybody had symptoms beyond that it was kind of seen that they were faking it or they were just making things up, or especially if it was a work comp injury that they just didn't want to get back to work. I will tell you that's very rarely the case that somebody doesn't want to get back to work. Most patients that come through my door want to get back to work, and they're very frustrated by the fact that they can't because they have these lingering symptoms. And the newer research shows that approximately 50%, so about half of all people that have brain injury will continue to have symptoms up to the year, and about a third continue to have symptoms well beyond a year, that post-concussion syndrome or persistent post-concussive symptoms. We know now that that's the case. So why are we still judging and saying that people don't want to get better or that there's nothing to do for them? That's really not the case. But this is what happens when people either don't get it diagnosed or they don't get the diagnosis right away, or they're told that they just had a concussion and they'll be fine. And that's why most people don't go in for a concussion, because they think there's nothing that can be done. Again, that's what we're going to talk about today. So what happens if you missed that diagnosis? If somebody doesn't give you a diagnosis, you didn't go in, you didn't get seen, you don't know for certain, you think you might have had a concussion because maybe you saw some stars, but you didn't really go anything beyond that. And you don't really put two and two together to think about some long-term consequences that can happen because of it. So early on, some of those first symptoms that bring people in, usually it's a headache. Most people, if they have a headache, they're going to come get seen because they want to figure out, why am I having this headache and what can you do to get rid of it? Unfortunately, a lot of people kind of want that easy button. They're going to say, okay, well, what medication can you give me to get rid of this headache? And that's not the first place that I start. So I don't start with medications right away, because there's a lot of things we can do to fix the underlying problems so that you don't have to have the headaches. You don't have the need for the long-term medications because we've treated the cause. So when we treat that cause, your headache tends to get better. You don't need all of those prescription medications. Is that always the case? No. Sometimes people still need the medications because they have issues, but that's okay too. And it's sometimes not a long-term thing, so people don't necessarily need medications long-term for those headaches, but they do need to be treated for that underlying cause. So when we're not treating that underlying cause, people aren't coming in because they think nothing's going to happen. What happens then? We can see a worsening of their symptoms. So over time, those symptoms that you had at the beginning that you didn't really address because you thought they were just going to be fine, or you were told that they were going to go away within a month and then they didn't go away, those can get worse because over time, if you're not addressing the cause, that underlying problem, the inflammation, the changes in the brain on the chemical level, on the electrical level, we're not changing those things, we can see those symptoms worsen because we haven't treated them. We haven't done anything to calm them down. And then when we keep pushing through to keep going for life, and life doesn't stop when you have a brain injury. So as we keep pushing through all of those things, those symptoms can get worse over time. So yes, they can get worse before they get better. We can end up with chronic problems. So somebody that had a headache right away, if we didn't address it, we didn't find the root cause of it, we didn't do anything to treat it. And I've seen a lot of those patients coming in and they actually have visual issues that weren't addressed. And when we address those visual issues, their headaches get better. But if we would have addressed those visual issues right away, they might not have had those headaches turn into chronic. And once you've had something for 3 to 6 months, then we start calling it chronic. Well, what if we treated them earlier? They wouldn't have those chronic headaches. They wouldn't be in that place where we're starting to put them on prescription after prescription, trying to find something that works for them. And nothing against any of my colleagues that love to use those prescription medications, because there is a place for them. But if we start that before we really address what's going on with the person and really address all of their symptoms, then we start down this spiral of we're getting into chronic issues and we have the need for these medications. And then we can see changes in cognition and memory issues where, yes, that's a symptom of a concussion. It's a symptom of a head injury. But if we're not addressing it, those things get worse. If we're not addressing that underlying cause, we're not treating the head injury itself, those memory issues do get worse. And that's, again, where so many people are coming to see me now in clinic. They've had these issues for a long time and they're coming in, is there anything you can do for me? Well, yeah, let's see what you've done before. We probably can switch things up a little bit or add some new things or do things that you just never did because you were told it was going to get better and then it didn't get better. Emotional and psychological changes. Again, this is something that we talk about as a common thing that happens with a brain injury. Somebody ends up with depression, anxiety, some changes in personality. They might be a little bit more irritable. Those things, yes, can happen with a brain injury. They can happen with a head injury of any degree. But if we're not addressing them, those will tend to get worse as well. And once we've had those emotional, personality changes, things that affect our frontal lobe, that's where our personality lies. That's where our judgment lies. That then increases our risk for subsequent injury, having another head injury, having a higher risk and higher rate of mortality, meaning we might not live as long because we tend to make poor choices. We're not as safe as we used to be. We don't have the memory to remember that we need to do things to keep us safe. And all of that tends to get worse over time. Will it get worse over time if you got the diagnosis? Sometimes yes. But as we do appropriate treatments for it, we can reverse some of that risk of those things continuing to get worse. And then physical limitations. If somebody has weakness, they have an injury, they have other things going on with that. If we're not addressing those physical limitations or those physical injuries, those will get worse as well. And I can tell you that from a recent conversation of mine, because I may or may not have had a mountain biking accident at the end of the summer. And I may or may not have given myself another small concussion that made me not pay attention to my shoulder. And now I've got some stiffness in the shoulder because that injury didn't get addressed. There is that risk that when you have a brain injury and you're not fully paying attention to everything, you don't get the healthcare that you need for other issues as well. So, total side note on that one. But all of these things can happen if we miss that diagnosis. If we didn't go in for the diagnosis, we didn't go in for treatment because we didn't think anything could happen. We didn't think they were going to do anything for us. So we just didn't go in to begin with. Or you went in, somebody told you had a concussion and you'll be just fine in a month. And if not, then go see neurology. Yes, there are things that we can do, and there are things that we still can do later on, and I'll talk about that in a moment. But why is it important to get that diagnosis early? Truly, the biggest thing is that it improves your quality of life. When we get that diagnosis early, we get the treatments early, we get you into rehab, whether that's PT, OT, or speech therapy, or we do red light treatments, or we do any of the other long host list of treatments that I've talked about on the show here, that all of my guests have shared, that I've talked about. All of those things improve your quality of life because they improve those symptoms that you're experiencing from a brain injury. And when you get that diagnosis, it gets you into those treatments. You can't get into those treatments if you didn't get the diagnosis. If you don't see somebody who can adequately identify the fact that you've had a brain injury, that you have some symptoms that you need to treat, you're not going to get the treatment, and therefore your brain won't necessarily improve like it could. How does our brain heal after a brain injury? The biggest thing for you to know is that it heals in two main ways. One is that those cells that were injured wake up and they take on their job. They do the job that they were born to do, created to do. They wake up and that gets fixed. And for some people that happens, that those cells do wake up, they get out of their little stunned sensation and they start doing the things that they're supposed to do again. And the other way to heal is through neuroplasticity. We learn to do things differently. Our brain takes on different roles, different cells in our brain takes on the different roles so that we can do things that do some of those things that we used to do, but in a different way. So as I'm going through my work days now, I used to be able to review all 10 to 14 patients that I would see in the hospital. I would see them all. I would write down maybe a few little details, but I would remember most of the history. I would go see them all. And then I would sit down and write my notes, and I still remembered everything as I went with writing very, very few notes. Now I have my little notebook with me, my handy dandy notebook, and I'm writing details down and I'm writing all of that information down because if I don't write it down, I'm not going to remember it. So that's my little way to get through my day now, because as long as I write down the details, I will remember them to document them and treat and address them. So I'm starring things and flagging them as we go so that I will come back and talk about it at the end of the appointment. So we address all of those main concerns and I'm not missing anything. So I'm still providing really good care, but I'm remembering those details in a different way because I've had to adjust for that and compensate for that, I guess. So that's your two ways of your brain healing. Neuroplasticity sometimes will happen on its own. So it is possible for people to recover on their own after a brain injury. But sometimes we need some help, and that's where therapy comes in, and that's where you need those referrals. So if you don't get the referrals to speech language pathology to work on your cognition, you don't get the referral to occupational therapy to work on your vision or to physical therapy to work on your balance, you don't get those referrals, you don't get the treatments, you don't get better as well as you could have. That said, if you don't get that treatment right away, if you come in months later, years later, and you're not just now identifying and being able to put things together and making 2 and 2 equal 4, and now we know that you have a brain injury, and now we know that all of these things have happened since your brain injury, because then we try to figure out, okay, well, when did your concentration issues start? Did you have them before you had this car accident, or was it something after? Did you have them before you fell and hit your head? or didn't even hit your head, you caught yourself, didn't quite hit your head, but then you had the symptoms after, then it's probably related to your brain injury. Things don't just necessarily pop up out of the blue for no reason on a regular basis. Usually there's something that triggers those things. And if you fell, if you had an injury, if you had a car accident, if you had a whiplash event, and then you had all these symptoms start up, yeah, it's probably related to a head injury. Because yes, you can get a brain injury from whiplash from not even hitting your head. So months later, years later, you're coming in to get some treatment. Can there still be something done? And this is the question I get all the time from people with their loved ones that they're sitting in the patient's family's chair. They're not the patient in my office. They're the family member that maybe they had the brain injury in the past, or a sibling of their child that they're bringing in, or whatever the case may be. Joe Schmo down the road, their neighbor that they knew that had an injury. And now they're asking, can something still be done for this? Yes, 100% something can still be done for this. What does that recovery look like? It's going to look a little different. It's going to take more work. It's going to take longer. And you're probably going to see less complete recovery. So you're probably not going to recover back to 100% of what you were previously, because extra time has gone by. It's going to take some time to try to wake those cells back up. It's going to take some time to create new pathways in your brain so things work appropriately. And it might not heal 100%. And that's okay. And that's the part where people struggle, is they really want to get back to their old selves. They want to do the things that they did before. You might be able to do some of those things just in a different way or slower, and you might have to take breaks. Still do it, but different than you did before. And that's okay too. And the one thing that my husband kept telling me over and over in my recovery is that even if I hadn't been in a car accident, I still wouldn't be the same person today as I was the day before the accident, because we grow, we change. And there's a question on my questionnaire that's built into the concussion evaluation on a scale of 0 to 6, with 0 being your normal, your baseline, and 6 being completely different from where you were before. Where would you rate that yourself in that 0 to 6? And I'm not a fan of that 0 to 6 rating scale, because it's not often that people actually get back down to that 0. Something is going to be different. And even if you get to all your same activities, you might not be doing it the same pace you were before, or the same way that you were before. And we all grow and we change over time anyway. So are we supposed to be back at that baseline where we were before? Or can we grow? Can we change? Can we learn from that experience? I learned so much from my experience that it has shaped what I do now on a regular basis. Am I ever going to say that I'm back to that 0? Probably not, because I'm not the same person that I was before I had my injury. I've learned a lot since that time. But as I've talked about on the show here too, as we learn about all these different treatments, as we try all these different treatments over time, if you've done the traditional treatments and you're still not seeing a whole lot of improvement, or you came to a standstill, you're on a plateau, you're not getting much better, we need to switch things up. So can you still get better later on if you get later treatment? Yeah, it's going to be a little bit harder. It's going to take longer, but you still can. I've met people years after their injuries, years, decades after their injuries, and we have tried something new. And guess what? They see some improvement. They see some decrease in their symptoms, or complete resolution of the symptoms that they had before in some cases. And that's because we've tried something that they didn't try before. Sometimes that's just treatment in general, because they may not have gotten treatment before. I've got some that had injuries when they were kids and they're adults now. And we're just looking back to say, yes, that happened. And yes, things changed for you. And now you have these symptoms, and let's figure out how to manage them. Let's learn how to figure out different ways to get through your daily life. And I've sent some people to speech therapy a decade after their injury because they needed to work on some cognitive issues, and they learned some tips and tricks that helped them. So yes, you can get treatment later on. Yes, your brain can heal. Yes, you can mold your brain and learn something new. Neuroplasticity does not end at any given age. So even if you are of any age and you go see a concussion provider, you can still see improvement. It just might look a little bit different than if you were a younger person. So what happens if we miss that diagnosis? There are some consequences for it. Can we get the diagnosis later on and still get some improvements? Absolutely. So that's my biggest takeaway for you today. So not as long of an episode as we normally have, but still some really good nuggets in here for you to listen to. So if you have questions for me, things that you want me to address, things that you want to see coming up in future episodes of the ABCs of concussion, because the last one we did was letter, I believe. So We're moving on to letter N with the next time I come back with that in a couple weeks here, probably. But let me know if you have any particular topics you'd like me to address and talk about. I'll be glad to work them into the show plan. So thank you again for being here today, you guys. Next week is this week is Thanksgiving. My goodness, this week is Thanksgiving. So I am thankful for all of you that are here on a regular basis listening to the show. And I will ask you that you put in some kind of comments or the show, give it a review. That helps me see it so much better. So it helps other people see it so more people can listen. So if you like the show, if you like what you hear, leave me a review, and I'll be very grateful for that as well. So thank you guys all for being here. We will see you next week. Have a great Thanksgiving. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.